Can medication or therapy alone solve mental health issues? Many people believe that either medicine is a magic bullet or that therapy can heal all wounds. But what if the best approach combines both? Or is it something else entirely? In this video, we'll break down the myths and facts, exploring the power and limitations of medication and therapy in treating mental health conditions. Stay tuned to discover which path might be best for you or a loved one. Let's understand how medication works. Medication plays a crucial role in regulating symptoms of mental health conditions by addressing biochemical imbalances in the brain. Conditions like depression, anxiety, bipolar disorder, and schizophrenia often involve disruptions in the production, regulation, or reception of neurotransmitters, chemical messengers like serotonin, dopamine, and norepinephrine. These chemicals are essential for mood regulation, energy levels, cognitive function, and emotional stability. If you or someone you know is experiencing challenges related to mental health, remember you don't have to go through it alone. We are here to support you on your journey to wellness. You can reach out to us anytime at mentalwellnesszone01@gmail.com or connect with us on Instagram. Our handle is in the description. We also offer online sessions tailored to help you achieve a healthier, more balanced life. Don't wait, reach out today, and let's work together to build a brighter, more fulfilling lifestyle. We are here for you. Medications can adjust these chemicals to help stabilize mood, reduce intrusive thoughts, and manage extreme shifts in perception or behavior. It's essential to note that different medications serve unique purposes. Antidepressants, for example, increase serotonin to improve mood, while antipsychotics regulate dopamine to reduce symptoms of psychosis. Unlike over-the-counter medications, psychiatric drugs often require weeks to show their full effect and are best taken under professional supervision. Example, a person diagnosed with major depressive disorder, MDD, might start taking SSRIs, selective serotonin reuptake inhibitors, which work by increasing serotonin availability. This doesn't create an instant feeling of happiness but gradually alleviates the profound sadness, lack of motivation, and low energy associated with depression, helping the person engage more fully in daily life and possibly in therapy. Let me tell you one interesting myth and fact you should know. Myth: medication will change your personality or make you feel numb. Fact: properly prescribed medication is designed to alleviate symptoms without altering core personality traits. It aims to bring the person closer to their natural state, not suppress emotions or numb feelings. How therapy works and its different approaches. Therapy is a conversational approach that allows individuals to process their experiences, understand thought patterns, and develop coping mechanisms. Unlike medication, which targets chemical processes, therapy targets the thought and behavior patterns that contribute to mental health struggles. There are various therapeutic methods tailored to different needs. Cognitive behavioral therapy, CBT, for instance, is highly effective for anxiety and depression because it helps clients identify and reframe unhelpful thought patterns. Dialectical behavior therapy, DBT, focuses on emotional regulation, mindfulness, and interpersonal skills, especially useful for borderline personality disorder. Psychodynamic therapy, on the other hand, explores past experiences and unconscious processes that shape current behavior. The therapist provides a safe space, guiding individuals in self-reflection, emotional processing, and problem-solving, which in turn helps them navigate challenges and reduce symptoms. Example, someone with generalized anxiety disorder, GAD, might use CBT to address recurring thoughts of worst-case scenarios. Through CBT, they learn to identify these thoughts as irrational, replace them with balanced thinking, and practice strategies to prevent escalation, significantly reducing their anxiety. Myth: therapy is only for people with severe mental health issues. Fact: therapy is valuable for anyone seeking personal growth, stress management, or coping strategies, regardless of the severity of their issues. It's a proactive approach to maintaining and improving mental well-being. When medication is more beneficial than therapy. Medication may be more beneficial than therapy alone in cases of severe mental health conditions where symptoms are too overwhelming to manage through talk therapy initially. Mental health disorders like bipolar disorder, schizophrenia, or severe depression may cause symptoms that make it difficult for a person to engage fully in therapy without first stabilizing through medication. For these individuals, medication provides the stability needed to prevent extreme mood shifts, psychosis, or debilitating anxiety. In these cases, medication becomes a prerequisite for therapy to be effective because it helps the individual reach a baseline level of stability. Example: a person diagnosed with schizophrenia may experience intense auditory or visual hallucinations, making everyday tasks and interactions challenging. Antipsychotic medication can help reduce these symptoms, allowing the person to participate in therapy sessions where they can work on coping strategies, social skills, and routines that improve their quality of life. Myth: people who take medication don't need therapy. Fact: while medication can control symptoms, therapy is crucial for developing the tools to manage triggers, understand one's condition, and maintain improvements over time. When therapy may be more effective without medication. In addition to its effectiveness for mild to moderate mental health issues, therapy can be invaluable for individuals who are managing specific life transitions, relationship conflicts, or work-related stress. It offers a safe and confidential space for people to explore their thoughts and feelings, which can lead to breakthroughs in self-awareness and understanding. This self-discovery often plays a crucial role in helping individuals identify the root causes of their distress, which is essential for lasting change and emotional growth. Therapy is also highly customizable, allowing therapists to adapt techniques based on the unique needs of each person. Cognitive behavioral therapy, CBT, for example, helps individuals challenge unhelpful thought patterns, while modalities like dialectical behavior therapy, DBT, focus on emotion regulation and building interpersonal skills. Through these varied approaches, therapy can be tailored to address both immediate challenges and long-term goals, providing a holistic path to recovery. Moreover, therapy helps individuals cultivate resilience, which not only supports them through current challenges but also equips them with tools to face future difficulties. By developing better emotional regulation and coping skills, many people find they can prevent future mental health crises, reducing the risk of more severe symptoms that might later require medication or more intensive treatment. Example: for a person going through situational anxiety, such as job stress or life changes, therapy can be a way to gain perspective, reduce immediate stress, and build confidence in handling similar situations in the future. Myth: therapy is only useful if symptoms are severe. Fact: therapy is preventive as well as restorative. It equips people with strategies to manage symptoms early, often preventing the need for medication and reducing long-term mental health impacts. Combination therapy: medication and therapy together. Combination therapy, integrating both medication and therapy, offers a synergistic approach for treating a wide range of mental health conditions. In complex cases like bipolar disorder, schizophrenia, PTSD, and major depressive disorder, combining these two methods tends to produce superior results compared to using either one alone. While medication can provide a quicker response, alleviating immediate symptoms such as mood swings, intrusive thoughts, or severe anxiety, therapy fosters long-term healing by addressing the root causes and teaching sustainable coping skills. One major benefit of combination therapy is the versatility it offers in tailoring treatment. For example, medications such as antidepressants or mood stabilizers help manage the brain's chemistry, which is often disrupted in mental health conditions. This stabilization allows individuals to engage in therapy more effectively, as they are less likely to feel overwhelmed by the intensity of their symptoms. On the other hand, therapeutic approaches, whether cognitive behavioral, dialectical behavioral, or psychodynamic, work on altering dysfunctional thought patterns, improving emotional regulation, and building resilience. This blend of approaches ultimately provides patients with a dual toolkit: medication for symptom control and therapy for deep psychological work and lasting lifestyle changes. Studies show that combination therapy not only accelerates symptom improvement but also reduces the likelihood of relapse. Patients who receive both treatments tend to experience greater self-awareness and are more prepared to handle future challenges. Additionally, combination therapy can reduce the long-term reliance on medication alone, as patients gain skills through therapy that can sometimes lead to lower doses or gradual tapering under professional guidance. For conditions like PTSD and severe depression, which often involve both biological disruptions and psychological trauma, this balanced approach helps individuals manage immediate symptoms and gradually work through underlying issues, leading to more sustainable recovery and a higher quality of life. The role of lifestyle changes alongside medication and therapy. Number 1. Sleep and mental health. Quality sleep is essential for mental health, as sleep disturbances are often linked to increased anxiety, depression, and other emotional challenges. Establishing a regular sleep routine helps restore cognitive function, improve mood stability, and reduce irritability. Good sleep patterns support emotional regulation and allow the mind and body to reset, creating a stronger foundation for mental well-being. Number 2. Nutrition and brain health. Maintaining a nutritious diet rich in essential vitamins, minerals, and antioxidants has a direct impact on brain health. Foods like leafy greens, whole grains, fatty fish, and fruits not only reduce inflammation but also help stabilize neurotransmitters. This, in turn, supports cognitive function and boosts mood, contributing to a more balanced emotional state and enhancing the effects of mental health treatments. Number 3. Exercise and mood improvement. Regular physical activity significantly benefits mental health by increasing endorphin and serotonin levels, which are natural mood enhancers. Exercise not only helps reduce symptoms of anxiety and depression but also boosts energy, improves self-esteem, and builds resilience against stress. Incorporating physical activity into daily routines amplifies overall mental well-being, complementing both medication and therapy. Number 4. Stress management techniques. Stress management practices like mindfulness, deep breathing exercises, and meditation can have a profound impact on mental health. These techniques lower cortisol levels and encourage relaxation, which helps counter the negative effects of chronic stress on the brain and body. Consistently practicing these techniques builds resilience and supports a calm, stable mindset. Number 4. Holistic support for sustainable recovery. When combined, sleep, diet, exercise, and stress management provide a holistic foundation that enhances the effects of medication and therapy. These healthy habits help prevent symptom exacerbation, reduce relapse risks, and instill a sense of control and empowerment in individuals. Integrating these practices into one's life fosters long-term mental well-being and offers a sustainable path to recovery. Here are 5 myths and facts you must know for a better understanding of mental health. Myth: only medication can treat mental health conditions. Fact: only medication can treat mental health conditions. Myth: exercise has no impact on mental health. Fact: regular exercise boosts mood and reduces anxiety. Myth: a poor diet doesn't affect mental well-being. Fact: nutritious foods support brain health and mood stability. Myth: stress is harmless if you're young. Fact: chronic stress affects mental health at any age. Myth: good sleep is optional for mental health. Fact: quality sleep is essential for emotional stability and resilience. Myths and misconceptions about medication and therapy. There are numerous myths surrounding the use of medication and therapy in mental health treatment. Some people believe that medication is a quick fix or that it leads to dependency, causing them to hesitate before considering it as a treatment option. Others worry that therapy is only for those with severe mental health conditions, overlooking its benefits for those dealing with everyday stress, relationship issues, or mild anxiety. Furthermore, some individuals feel that choosing one form of treatment negates the need for the other, when in fact, the two often complement each other. For example, while medication may stabilize symptoms, it may not address the behavior patterns or thoughts that exacerbate the condition. Conversely, therapy alone may not fully relieve severe symptoms that stem from neurochemical imbalances. Debunking these myths is essential in encouraging individuals to approach treatment with an open mind and recognize that different treatment combinations can meet different needs based on the severity and type of condition. Accessibility and affordability in treatment choices. A significant factor in deciding between medication and therapy is accessibility. Medications can sometimes be covered by health insurance and may be more accessible for individuals living in areas where therapists are scarce. Additionally, Medication requires less time commitment compared to therapy, which may require weekly or biweekly sessions over months or years. Therapy can be costly and may not be covered by insurance, creating a barrier for some individuals. On the other hand, therapy has the advantage of empowering individuals with skills to manage their mental health in a way that medications alone cannot. Online therapy platforms have emerged in recent years, improving accessibility by connecting people with therapists virtually, though they may not be suitable for everyone. For individuals facing financial constraints or limited local resources, balancing the benefits and drawbacks of each treatment approach becomes crucial. Personalizing treatment plans, tailoring approaches for effective recovery. Every individual's mental health journey is unique, requiring a personalized treatment plan. Factors like the severity of the condition, personal preferences, response to medication, and therapy availability play significant roles in determining the right treatment mix. Some individuals may benefit more from medication to manage acute symptoms in the short term, followed by a gradual shift to therapy for long-term management. For others, therapy alone may provide sufficient support without the need for medication. Open communication with mental health professionals enables individuals to make informed decisions, understanding how different approaches can work together to foster a sustainable recovery. Recognizing that treatment is not one-size-fits-all encourages people to advocate for themselves, exploring and adapting their approach as their needs evolve. Ultimately, a flexible and responsive treatment plan, whether it involves medication, therapy, or a combination of both, can provide the best chance of improving mental health and quality of life. Recognizing cultural influences in mental health treatment. Cultural factors significantly shape how individuals perceive and respond to mental health treatment. In some cultures, there may be a stigma around medication, while in others, therapy may be viewed with skepticism. Cultural beliefs and values can impact whether individuals feel comfortable seeking help, trusting their healthcare providers, or adhering to treatment. For instance, some communities may place a strong emphasis on family and social support, preferring these as primary methods of managing mental health challenges. Understanding and respecting these cultural perspectives is crucial for mental health professionals, as it allows them to tailor treatment approaches in ways that align with the patient's values and increase their comfort with the process. Providers may, for example, involve family members in therapy sessions or incorporate culturally relevant practices, such as spiritual support, to enhance treatment effectiveness. This cultural sensitivity fosters a more inclusive mental health care environment and ensures that treatment respects and meets the diverse needs of individuals. Balancing short-term relief with long-term resilience in treatment. One of the most significant decisions in mental health treatment involves balancing immediate symptom relief with building long-term resilience. Medications often provide faster relief by targeting symptoms directly, which can be crucial for individuals dealing with severe or debilitating conditions. However, therapy, particularly approaches like CBT and DBT, builds foundational skills for managing stress, developing healthy thought patterns, and cultivating emotional resilience over time. This balance is especially relevant in conditions such as anxiety and depression, where individuals may rely on medication initially to stabilize, allowing them to participate more fully in therapy. Over time, as therapy progresses, patients may find they need less medication or that they have developed new coping mechanisms that reduce their reliance on pharmaceuticals. This approach helps individuals transition from a focus on immediate relief to one on sustainable mental health management, equipping them to handle future challenges more independently. Evaluating the evolving field of mental health treatment. The field of mental health treatment is continuously evolving, with new medications, therapeutic approaches, and technologies emerging to enhance care. Innovations such as teletherapy, digital mental health tools, and emerging fields like psychedelic-assisted therapy have opened new avenues for treatment and accessibility. For instance, teletherapy platforms have made it easier for people in remote or underserved areas to access therapy, while digital tools like mental health apps offer techniques and resources to support users in managing symptoms independently. Research on psychedelics, which were once stigmatized, is showing promise for treatment-resistant depression, PTSD, and anxiety, offering hope for those who have not found success with traditional methods. Keeping up with these advancements allows patients and providers to explore new options that may complement or enhance traditional medication and therapy approaches, adapting treatment plans in ways that align with the latest scientific insights and patient needs. The importance of ongoing support and adjustment in mental health treatment. Mental health treatment is rarely a linear path, it often requires ongoing support, assessment, and adjustments. Over time, individuals may experience changes in symptoms or life circumstances that affect their mental health, necessitating a reevaluation of their treatment plan. Regular check-ins with healthcare providers, whether for medication management or therapy progress, are essential to ensure that treatment remains effective and relevant. For example, a person with generalized anxiety disorder might benefit from a particular therapy approach initially but may later require a different method or medication as they progress or face new challenges. The flexibility to adjust medication dosages, try different types of therapy, or incorporate supplementary treatments allows for a more adaptive approach to mental health care. Continuous support helps individuals maintain their progress, prevent relapse, and feel encouraged to prioritize their mental well-being, knowing that their treatment plan can evolve alongside them. The impact of medication and therapy on relationships. Both medication and therapy can have a profound impact on an individual's relationships with others. On one hand, successful treatment can lead to improved mood and functioning, enhancing a person's ability to interact positively with family, friends, and co-workers. For example, treating depression with medication may restore a person's interest in socializing, while therapy can help them improve communication and manage conflicts more effectively. On the other hand, mental health conditions themselves can strain relationships, and individuals may struggle to explain their symptoms or treatment needs to loved ones. Therapy can help couples or families better understand the challenges of living with mental health conditions and offer tools for supporting each other. In some cases, individuals might experience tension in relationships due to side effects of medications or the emotional intensity of therapy. Open communication and setting realistic expectations are key to minimizing the impact of these challenges and fostering supportive relationships during treatment. The ethical considerations in medication and therapy decisions. When deciding between medication and therapy, ethical considerations are often at the forefront. Mental health professionals must ensure that treatment decisions are made in the best interest of the patient, taking into account their preferences, values, and potential side effects. Informed consent is crucial, as patients must fully understand the benefits and risks associated with each treatment option. For instance, certain medications may have significant side effects, which might deter patients from continuing them, while therapy might require confronting painful emotions or memories that could be difficult for some individuals to process. There is also the issue of autonomy. Patients have the right to choose the treatment path they believe is best for them, even if it differs from the professional's recommendation. Mental health providers must navigate these ethical dilemmas with care, providing information, support, and respect for the patient's choices while ensuring that all possible risks are communicated. The role of prevention in mental health care. Prevention plays an essential role in mental health care by addressing potential mental health challenges before they become full-blown disorders. Programs focused on early education, stress management, and emotional resilience can equip individuals with the tools to manage life's challenges in a healthy way, reducing the risk of mental health problems in the future. Preventive measures, such as teaching coping strategies in schools or workplaces, can reduce the need for extensive therapy or medication later in life. Additionally, maintaining regular mental health checkups, even for individuals who do not have diagnosed conditions, helps identify early signs of distress and allows for proactive interventions. Emphasizing prevention through lifestyle choices, social support, and education can help reduce the prevalence and impact of mental health disorders, leading to healthier communities overall. The journey of mental health recovery. Mental health recovery is a personal, nonlinear journey that can take varying lengths of time depending on the individual, the nature of their condition, and the treatment they receive. Recovery involves much more than simply alleviating symptoms. It's about building resilience, developing coping strategies, and regaining a sense of control over one's life. For some individuals, recovery might take several months, while for others, it can take years. It is important to acknowledge that mental health recovery is a deeply individualized process. What works for one person might not work for another. However, with the right combination of medication, therapy, and lifestyle changes, most people can make significant progress over time. The first step in the recovery process typically involves acknowledging the need for help and taking the first steps toward seeking treatment. This initial phase, where a person reaches out for therapy or seeks professional guidance, can take anywhere from a few days to several weeks, depending on personal circumstances and support systems. The acute phase of treatment, 1 to 3 months. During the initial phase of mental health treatment, which usually spans 1 to 3 months, the focus is on stabilization and managing the most immediate symptoms. If medication is prescribed, the first few weeks might involve adjusting to the right dosage and monitoring side effects. It is not uncommon for people to feel a sense of relief as medication begins to take effect, though it can take several weeks for antidepressants or anti-anxiety medications to show their full benefits. Therapy, whether cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, or another modality, also begins in this phase. The goal is to introduce coping strategies, identify negative thought patterns, and start working through immediate emotional concerns. Individuals might find this phase emotionally intense, as it requires confronting difficult feelings and learning new ways of thinking and behaving. The acute phase can be challenging, as it involves some trial and error in finding the most effective treatment approach, but with professional guidance and a willingness to engage, progress can be made. The adjustment and integration phase, 3 to 12 months. The next stage of mental health recovery involves adjustment and integration, which typically spans between 3 to 12 months. At this stage, individuals begin to see more noticeable improvements in their symptoms and overall functioning. Therapy sessions become more focused on skill building, such as developing resilience, improving self-esteem, and managing stress in a more sustainable way. Medication may continue to be adjusted to optimize effectiveness and minimize side effects. People often begin to notice a decrease in the intensity of their symptoms, but it's important to note that recovery doesn't mean being completely symptom-free. In fact, this phase often involves accepting that mental health struggles may be a lifelong challenge, but learning how to manage them more effectively. For many individuals, their confidence and coping mechanisms grow during this time, and they may begin to re-engage with activities they once enjoyed or take on new challenges. The adjustment phase is marked by significant growth, but it also requires ongoing commitment to treatment and self-care. The maintenance and long-term recovery phase, 1 to 5 years. Long-term recovery, which may take 1 to 5 years or more, is focused on maintaining the gains made during the earlier phases and preventing relapse. In this phase, people continue their therapy and medication regimens, but they may also start to develop more autonomy in managing their mental health. For many, the goal is no longer to eliminate symptoms but to live a fulfilling life despite ongoing challenges. Support from family, friends, and peer groups plays a significant role in long-term recovery, helping individuals stay grounded and connected to their community. Individuals may encounter setbacks or difficult periods during this time, and it is important to understand that recovery is not a straight path. Relapse doesn't mean failure, rather, it's an opportunity to reassess the treatment plan, re-engage in therapy, or adjust medications. During this stage, people work on reinforcing the skills learned earlier, such as recognizing early warning signs of distress and implementing coping strategies before symptoms worsen. The key to long-term recovery is resilience, self-compassion, and a commitment to staying proactive in managing mental health. Ongoing growth and flourishing beyond recovery. After years of treatment, individuals may find that their recovery has transitioned from mere symptom management to a stage of flourishing. While recovery in mental health is a lifelong process, many people in long-term recovery report a sense of personal growth, deeper self-awareness, and a renewed sense of purpose. This stage is often marked by a greater sense of balance in life, where people can pursue their passions, form meaningful relationships, and contribute positively to their communities. Individuals might also shift their focus to personal development goals, such as career advancement, creativity, or spirituality, having already developed the tools needed to manage their mental health. While occasional struggles may still arise, individuals in this phase often feel more empowered to handle challenges effectively. The timeline of mental health recovery varies significantly, but for many, recovery is not about returning to a pre-illness state, it's about evolving into a more resilient and self-aware version of oneself. The focus is on living a meaningful life and achieving personal goals, which may be shaped by the experiences gained during the recovery process. Thank you for watching our video. We hope you found it valuable and insightful. Don't forget to like, share, and subscribe for more content like this.